everybody, welcome to your favorite show, Youth Diary. Kidney problems and issues are increasing day by day. Today, we have with us Dr. Georgy K Ninan, Senior Consultant Nephrologist, PVS Memorial Hospital and Lakeshore Hospital. Welcome, sir, to the program. So, doctor, you can see an increasing trend in kidney issues these days. So, what are the basic kidney problems and to what extent you can prevent them?
Kidney diseases are increasing in Kerala. To know about the kidney diseases, you have to know what is the function of a kidney. Kidneys are two organs situated on either side of the spinal cord, and 20% of the heart pumping goes through the kidneys. They filter these waste materials, water, and what is going out in a concentrated form is called urine. Around 180 liters of fluid is filtered in a day, but what is coming out is only 2 to 3 liters, which is called as urine. So excretory function is one. In addition, it metabolizes certain hormones which are necessary to keep the blood pressure, to keep the hemoglobin production in the bone marrow. It also produces certain hormones like vitamin D, activate the vitamin D which is needed for our bone and to strengthen the bone, calcium metabolism. So in other words, kidney is a chemism which maintains the blood biochemistry. There are many diseases which can affect the kidneys. The commonest one in Kerala or anywhere in the world is diabetes. As more diabetic patients who would have died in the past due to heart disease and stroke because of the good treatment are prolonging their life. So they don't die of heart disease now, but they die of kidney problem. You got the point. Kidney problems are increasing mainly because of diabetes. Kerala especially is having an increasing number of diabetes. By 2030, WHO estimates that China and India will become the diabetic capital of the world. So when diabetes is there for a long time, uncontrolled, or if they are prone for genetic capillary abnormalities we call as microvascular disease, it affects the eyes and the kidneys. So in the eye it will be produced as retinal changes. In the kidney it will be seen as protein leakage in the urine. Then it goes into the kidney failure where the waste materials keep accumulating in the blood and along with blood pressure producing kidney failure. So diabetes is the commonest cause of kidney failure. In my practice, 70% of patients who are coming for kidney transplantation are due to diabetes.
So doctor, we have few inquiries about it. The first mail is this.
Hi, my name is Vishal. My doubt is, what is nephrotic syndrome?
Very interesting question, nephrotic syndrome. Nephrotic syndrome is a type of kidney disease where the protein leakage in the urine is very high. There are many filters in the kidney, and due to many diseases of the kidney and diseases of the body which affects the kidney, ultimately produces the permeability of the filtering membrane. So more protein will leak into the urine. Normal protein leakage in the urine is 150 milligram. If you test a sample of urine, it is reported as 1 plus, 2 plus. Usually it will be negative or trace. So when you get trace to 1 plus protein leakage, you have to understand that the kidney filter is damaged, temporarily or permanently. And when it goes beyond 1 gram to 3 grams, we call it as a massive proteinuria, significant proteinuria, nephrotic range proteinuria. So when the protein is losing for a long time, these proteins get entrapped after the filtration in the various parts of kidney, produces inflammation and it produces damage. So when you have a lot of protein leakage in the urine due to any disease, then it produces low protein level in the body. Liver is the unit which manufactures the protein, in particular the albumin. So the liver is trying its best to produce albumin or protein. It cannot produce selectively the protein, it produces all the components of that production. One of the main component is cholesterol. So these patients will have protein in the urine, 1 plus 2 plus. If you evaluate 24 hours, it will be more than a gram, or when it is left untreated, it goes beyond 3 grams. Then you achieve the classical picture. Second is they will have low albumin in the blood, and 3, their cholesterol is going up. It is not because they eat a lot of fried items or fatty food or oily food. It is because the liver is producing and is a side product. So this triad is called nephrotic syndrome. Nephrotic syndrome does not mean any disease. It is just like saying that you have fever to us. So nephrotic syndrome, anybody having this is this. So what are the causes of nephrotic syndrome or kidney disease like this, protein leaking? One is primary disease of the kidney. It's seen mainly in younger people, children, adolescents. As you advance in life, this can occur less often but more refractory to treatment. They won't respond to the conventional treatment. They have got a brittle form of disease. The same disease occurring in elderly people. So we classify them into 3 groups. Good group, bad group, intermediate group to response to treatment. So there are many other internal diseases like diabetes and long-standing blood pressure and some of the diseases with joint pain in females, as well as some of the drugs. They all can produce protein in the leakage, protein leakage in the urine, coming into nephritis or nephrotic syndrome. Then how do we diagnose this? We do the urine test, we do the blood test, we get all these pictures, but that doesn't take us anywhere. How do we predict that they will respond to the treatment? That is the proof of the pudding is eating it. That's what Britishers say. So here the patient should be happy, his protein level should be normal, cholesterol should come back to normal, his renal failure should be not happening as evidenced by a normal creatinine. So we do a kidney biopsy. Kidney biopsy means just like taking the blood, we put a needle into the lower part of the kidney. It's an automated gun, you shoot. You get a small piece as thick as a common pin, 1 centimeter to 1.5 centimeters long. Nowadays we do with the ultrasound guided real-time scanning so that we hit exactly the point. Of course, there should not be any bleeding parameters. Bleeding parameters should be normal. Bleeding tendency should not be there. Blood pressure should be controlled. It's a day care procedure. Morning they come, they finish, and they go back in the evening. They go back. So we take this, a lot of information will come. Then we send it to a renal pathologist. They will examine under the microscope. Special stainings are done, and then they will tell you how old is the disease. What is the basic etiology? Is it only confined to the kidney, or is it some coming from internal disease affecting the kidney? And then they will label it as many diseases.
So let's move on to the another question. This is the question.
Hi, I'm Adul. What are the drug-induced problems?
Very interesting. Second question is drug-induced kidney problems. When we say drug-induced kidney problems, the commonest thing which comes to my mind is painkillers producing problem. It can be dose dependent when you take a lot of painkillers for a headache or back pain or see. Second is even some people have allergic hypersensitivity reaction to one tablet. There are many young people who have come to me with the blood in the urine, puffiness of the face, they have taken some Brufen or like that medications for, we call it as non-steroidal anti-inflammatory drugs, NSAIDs. This is some people, 7% of kidney problem which I handle in my day-to-day practice is due to drug allergy in the kidney.
Okay.
Selectively in the kidney, no itching, no rash, nothing, only in the kidney. Presenting as blood in the urine, puffiness, albumin leakage. There are 8 or 9 families of medications which are coming in the group of NSAID. Second group which we deal is in the hospital. Radio contrast dye. Nowadays everybody goes for CT scan, angiogram, coronary angiogram. And those who have kidney dysfunction or early CKD, chronic kidney disease, when you get the dye, especially without precautions, they get into temporary kidney failure. There were a couple of people whom we had to dialysis them even to support till the kidney recovers. So these are the 2 main groups of then antibiotics. There are many other drugs which are known to produce kidney problem. What you have to understand is that even a normal person can get kidney problem with the hypersensitivity allergic reaction, which only time will tell after taking. Mistakes can be made or problems can occur, but the beauty is in identifying them and withdrawing the offending agent. Otherwise the story continues. Second group is the classical example is a elderly female with back pain, diabetic, hypertensive. Already they have kidney reserve less. They take this NSAID for some time. Then they develop kidney damage and come to us. Those are the people who need some support, some painkillers and all, So what are the safe painkillers from kidney point of view? I have told you what you should not take. Now I have to tell you what you should take, or you can say, if needed. Paracetamol is a good medicine which is safely used in kidney disease and even after transplantation. It is less irritant to the stomach also. You can get different combinations with paracetamol with sleeping medication, diazepam, different combinations are there. So that you can take. They are not very strong, but they are safe.
Thank you, doctor. Now we'll go to the question, another one inquiry. This is the third one.
Hi, I am Vishnujit Ji. What are the precautions for kidney stone?
Basically, there are 2 types of stones. One is calcium stone. Very hard stone, as hard as a granite, which will cast shadows in the X-ray. We call it as radio opaque. This will be seen in the ultrasound also, or CT scan is the best to diagnose stones. Calcium stones. Second type is a uric acid stone. Uric acid stone is not as hard as a granite, it is only hard as a clay, dried clay. All stones need not produce pain. All stones need not produce blood in the urine. Only when the stone is producing obstruction to the flow of urine, it produces pain. And when the stone moves, there will be blood in the urine. So our aim should be to identify, is it a calcium stone or a uric acid stone, because treatment is different. Whatever be the stone, you have to take plenty of fluid and take supportive therapy. Uric acid, there are specific medicines available now. And indications for surgery to me are 4 or 5. One, if the stone is obstructing, if the stone is producing pain. Or blood in the urine, yes, correct. And if there is a persistent urinary infection, like Bin Laden, you cannot eradicate him without crushing the stone behind which he is hiding. So you have to crush the stone. And lastly, if the patient wants, I don't want the stone, yes, we have to remove it. Medical indications are 4. Others are all very plus minus, We must try not to intervene, because intervention is associated with complications, especially infection. So we must try with medical management, good hydration, identify the type of the kidney stone, give supportive symptomatic treatment, specific treatment like in uric acid, and intervention when is needed in the appropriate way by a competent, clean, good surgeon who has enough of equipments with him. All these adjectives are very, very important.
Okay, thank you, doctor. Now we'll go to the another segment. There are a few queries that we've got through mail. So we'll go to the first mail. The first mail goes like, what's a urinary tract infection?
Yeah, urinary tract infection means infection, bacterial infection in the bladder or in the kidney. See, before the antibiotic, our parents all suffered from urinary infection. There are only very few antibiotics. Then a lot of antibiotics came and urinary infection came down. For any irritation in the bladder, in the bladder or any pustules in the urine, they will give antibiotics. So now we have the pendulum is taken to the other side. There is a re-emergence of urinary infection again, which is again troubling us. This urinary infection is characterized by dysuria, means pain while passing urine or burning sensation, classically described in a recently married female. It's called as honeymoon cystitis even, because they have got E. coli which is in the gut, which will come into the bladder because of more frequent intercourse, and the bladder gets involved. So it's known as honeymoon cystitis, known as dysuria, passing urine frequently, pain in the lower abdomen, and blood in the urine. Now what we are facing is this infection ascends up, it goes into the kidney. You get blood in the urine, rigor and fever, and the bugs go into the blood producing sepsis. So this is a very alarming situation. And if it is following a instrumentation in a hospital, you get hospital acquired infection. Bigger the hospital, the super is the bug. It's called superbug. What is the meaning of a superbug? They are resistant to all the common antibiotics. You have to shoot them with antibiotics worth 2,500 to 4,000 rupees per dose for 5 to 7 days. Story doesn't stop there. You stop it again, it comes. What do you do? This is what is troubling. So we should not take it to that extent. So what you should do? Take plenty of fluid. The early you get a urinary symptom, you anticipate. Anticipation is the key to success. You anticipate that you may have urinary infection, check your urine. Send it for culture before any antibiotic, so that you identify the bugs. See which is the best medicine for them. Hit them hard. Once they lie low, you maintain them for some time so that they don't resurge in that patient, especially if it is a hospital acquired infection. A person getting at home is different. They get only E. coli. What else can they get? In hospital we get XDR, that is what our microbiologists tell. We are scared. XDR means multi-resistant. Only one or two, and that is you have to spend a lot of money to get out of it. Still, you may not get in for some unfortunate people. So urinary tract infection is a very important thing which is re-emerging with more vengeance. You have to hit them hard if you want to treat.
Doctor, so any message to the viewers?
Yes, prevention is better than cure. How can you prevent kidney diseases? Take plenty of fluid, don't hold the urine, anticipate that urinary infection, especially females, take appropriate antibiotics, check urine once a year for all diabetics, once a year. If you have albumin, check the eyes for retinopathy. Check creatinine for all patients who are above 45, diabetic, urinary infection, stone, once a year. Any puffiness of the face or pedal edema, leg edema, you should alert that kidney failure can present with swelling, and you should consult your physician. A healthy habit is around taking say 15 glasses of water or fluid, approximately 2.5 to 3 liters of fluid. Try to avoid painkillers and the invasive procedures and the dye, because they can be harmful. At the same time, if it is needed, with the adequate precaution, You should go to a competent person and get it done and follow it up whether you have developed any complication of that. This is what the message to it.
Thank you so much, doctor. Thank you for taking a time out and for being part of this show. I'm sure that was a very interesting segment. So please mail your queries to youthdiaryroseball@gmail.com. See you soon. Bye.